All right, welcome back. I'm Dr. Deuk Majan at Deuk Spine Institute. We are here to perform a piriformis muscle release. Why? This patient has two piriformis muscles that are torn. Piriformis muscle is deep in the buttock. It's at the top half of your buttock. If this is the buttock here, it's in the top half, and it causes pain and tenderness in the top half of the buttock. Especially if you look at the hip and the butt crack, the tenderness is usually 50% halfway between the hip, side of the hip, and the butt crack. And you put your finger there and it's severely painful. The sciatic nerve runs through the piriformis muscle and down the leg. That's the sciatic nerve. So you can get sciatica, which is pain down your leg, when you have a piriformis syndrome, which is a torn muscle. The only way to fix this, we have been treating this condition for 27 years. The only way to get rid of this is to release the muscle. It's cut the muscle, basically. It's called a piriformis muscle release. We've tried shots, therapy, stem cells, injections, Botox, everything. But the symptoms always come back, and patients give up, and they end up self-treating. But if you want to actually eliminate piriformis pain, you have to release it off the hip. Bring in the x-ray. We're going to use x-ray guidance. I've already injected the skin. We've just finished a Deuk laser disc repair and a Deuk plasma rhizotomy for disc and facet pain at L3-4, L4-5 on the facets, but just L3-4 on the disc. Okay, we're ready to make our incision. We're rotated, guys. You can see my marker is in the perfect place for an incision, so I'm going to make that incision right now. 4 millimeter incision, 4 millimeter. I'm going to use my Deuk plasma wand to go down, and I'm going to dock on the basically what's called the posterior facet. Shot. All right, that's not the posterior facet. Here is the posterior facet. And you can feel it, shot. It's kind of slippery, but that is where the piriformis muscle attaches. So now I'm going to use my wand to release the muscle, and that will eliminate the piriformis muscle pain. The nice thing about our technique, and this is a technique developed here at Deuk Spine by me, and I'm the pioneer. This technique, I think, is better than any other piriformis release technique. Why? Because the other techniques are either open, where the surgeon is literally cutting your whole buttock open and cutting through your gluteus muscle, your gluteus maximus, very painful, takes forever to heal, and people hate it. Or they do endoscopic, which is we have a saying in spine surgery and neurosurgery, is called the dog's breakfast. And if you do an open or endoscopic, you're going to have a dog's breakfast. Okay? It just means a bloody, meaty mess. But this is incredibly elegant. I've pioneered this technique. It's the first of its kind in the world. Minimally invasive, done with a 4 millimeter incision, bloodless virtually. It is painful. I will admit, it hurts. You know, for a couple of weeks afterwards, people have pain in their buttock. And we're just putting a little medicine to make it feel better. We will put a staple there. We're going to move on to the left side. If you have questions, feel free to ask. But piriformis syndrome is one of the most underdiagnosed, misdiagnosed conditions that cause chronic back pain. Shot? All right. She has a prosthetic hip on the other side. That does not mean she can't have a piriformis. Shot? Are we rotated? So she has a piriformis on the left, even though she had hip replacement. Very common problem. We see this all the time. People get hip replacement, but they still have pain in the hip because the hip replacement surgery actually causes the piriformis syndrome. Why? Because during the surgery, they're twisting your hip around so much that they rip the piriformis muscle. Once the piriformis muscle is ripped, folks, it is not going to heal itself. It just cannot. We have tried for years getting these muscles to heal on their own, but they don't. We don't have a video for you yet, but we will very soon, showing you how a piriformis syndrome is causing pain, but also how to fix it. That's coming in the next month on Deuk Spine and on our Deuk Joint Institute as well. Any questions from the audience, Henry?
Yes, we got a question coming from Munya Radzi on YouTube.
Welcome to our live stream.
Asking,
Happy to take the question.
do you routinely screen for instability in such cases? Does this change anything on your treatment plan?
Yeah, great question. All of our patients are checked for instability. The problem is most people don't understand what instability of the spine is. They think they know what it is, but they don't. Most people believe spondylolisthesis or slippage of the bone is instability. It is not instability. Instability has been redefined by people who don't know what they're doing. And they're calling spondylolisthesis instability when they shouldn't be. Instability was first defined by Drs. White and Punjabi. 30 seconds. Dr. White and Punjabi defined spinal instability as a condition that exists that causes severe pain or neurological deficit, which is weakness, numbness, tingling from nerve being pinched or spinal cord being compressed, that occurs with normal physiological loads. What does that mean? It means that with normal lifting and bending and twisting, you get those symptoms. All right, we're done. So all of our patients that come here have instability. The Deuk laser disc repair procedure you just watched, last surgery, is the most stabilizing, least invasive procedure in the world for spinal instability. Now, we're not talking about instability caused by fractures, right? If you have a fracture from a car accident or a fall, you have instability. You have pain, you have neurological deficit, or one or the other. And that type of instability from a fracture dislocation is not what we do Deuk laser disc repair for. The vast majority of back pain, 85% of it is due to a disc injury, and it's called instability, but there's nothing unstable really about it in the sense that your spine's going to fall apart. And the Deuk laser disc repair restores stability to the spine by eliminating back pain and eliminating neurological deficits. So it is a stabilizing procedure without implants, by the way, and without bleeding, hospitalization, outpatient. All right, any other questions?
Yes, just one more question coming from Lanu on YouTube asking, what are the most common causes for hip injury?
What are the most common causes for hip injury? That's a great question, Lanu. I don't have the answer for you. I think trauma to the hip is probably the most common, either through a sports, athletics type of an injury, or it could be a fall, slip and fall, or an auto accident. But those are probably, trauma is the most common cause of hip injury. Other types of hip injury can come from autoimmune diseases or from doctors doing injections and things. We can injure hips as well. So you have to be careful where you go for your treatment and make sure you go to a doctor who knows what they're doing and they do a good job. And this patient is going to go home in an hour. She came from Idaho. She came here to Deuk Spine because she believes in us, and we fixed her back before. She had other issues that we fixed, and she was very happy. She ended up going to doctors in Idaho trying to find the same type of care she got at Deuk Spine, but they gave up because the doctors kept diagnosing them with different conditions that were the wrong diagnosis and recommending treatments that didn't work. So she came back, and now she's getting fixed, hopefully for the last time. Thanks for joining us. You've watched a bilateral piriformis muscle release. I'm Dr. Deuk Majan, CEO and founder and pioneer of this technique. Everybody, probably about 45 minutes for the next surgery, which will be a one level Deuk laser disc repair, lumbar.